Good morning. I am Roberta Maselli.
Hi, good morning. I'm Roberto de Sire.
We are working in Humanitas Research Hospital in Milan, Italy, and we are glad to be with you today to commentary the latest published paper on endoscopy. And the name of and the title of the paper is Outcomes of Endoscopic Submucosal Dissection for High-Risk Colorectal Colitis-Associated Neoplasia in Inflammatory Bowel Disease. So coming back to the background of this paper, we had the idea to collect the data from different 9 Italian centers about ESD on IBD, because we thought that this is a really hot topic in how to manage this type of very difficult lesion to treat endoscopically. And our aim was to demonstrate or to check the outcomes of ESD on IBD. This is the first paper published on a new network that is the ERIN, Endoscopic Resectional Italian Network. And as I was mentioning, is collecting data from different 9 Italian high volume centers. So let's discuss together, Roberto, what's the main results of this paper?
Yes, thank you, Roberta. We included in this retrospective study all consecutive colonic IBD patients referred to 9 expert Italian endoscopy centers that underwent an ESD or an hybrid ESD procedure for high-risk colorectal colitis-associated neoplasia. And from January 2016 to December 2022. The main outcomes of the study were the rate of bloc R0 and curative resections, and of course, adverse events, the rate of local recurrence at the follow-up colonoscopy, and metachronous lesions and post-resection surgery. We included 91 colonic long-standing IBD patients with 96 HRCAN, and ESD and hybrid ESD were performed in 82% and 17% of cases. Going to the results, we can see that bloc R0 and curative resections rate were achieved in 96, 85, and 83% of cases, while adverse events occurred in 12% of cases, all conservatively managed. After a mean follow-up of 2 years, we can see a local recurrence in 3% of cases and metachronous lesions rate in 3%, while post-resection surgery was required in 11% of cases.
Okay, so although it's a retrospective study, we arrived to very clear results, and this is one of the few Eastern and Western study about ESD on IBD. So what is, according to you, the best indication to propose ESD on IBD patient, according to the results of our study?
Yes, probably it is crucial to effectively stratify the IBD population that would benefit of this kind of technique, so an advanced resection technique, such as patients in remission with remission or mild activity of inflammatory bowel disease with no multifocality, so not too much lesions in the same patient, and of course, patient with a low risk of colectomy for the inflammatory bowel disease. And of course, patient that can adhere to a strict surveillance program after an ESD.
So this means that we should treat and manage this patient not only, let's say, endoscopically by a multidisciplinary approach together with the specialist on IBD, also for the long-term treatment.
Yes.
But we are still looking for long-term, really long-term results. So this is just the starting point from different studies that we need to collect also prospectively to understand really how to manage this type of difficult lesion to find and then to treat. But at least we are adding something new on the endoscopic technique that we can propose to our patient. So do you have anything else you want to add to this point?
No, Roberta, I would only like to thank you and the entire group for this great collaboration.
Stay tuned. Bye.
Bye.
Thank you.